I want to thank you as members of NCHA for allowing me to represent you this year. I'll do the best I possibly can. Recognizing that to be in this role, it does require time away from my regular job, which is the President and CEO for Southeastern Health. And I would be remiss if I didn't say thank you to the Board of Trustees for allowing me and supporting me in doing this, because it means I am away from the job that they hired me to do. I would also be remiss if I didn't thank my executive team, and they're sitting over here at the table with me today, because while I'm doing the work of NCHA, they're back in Lumberton doing the work of Southeastern Health. They're carrying on the mission, and guys, I could not do it without you. So thank you all very much, and I think they deserve some recognition as well. When I look around this room and I think about the organizations, the healthcare systems across our state, I see vibrant, rapidly changing organizations that are really poised to make a difference in their communities, and they've taken that on. I see leaders within those organizations that are impressive, they're committed, they're going to see it through. They're up to the challenge, and they've willingly accepted it. I see health systems that share a common mission to improve the health of our communities. I see health systems that share a common business need to transform from a payment structure centered around fee-for-service to one focused on a value proposition that includes pay for performance and managed care in various forms. You just heard the governor talk about Medicaid and what's happening there. I see health systems that share a desire to work with elected officials to meet the goals of the Triple Aim. I see health systems that want to provide the best care possible to the citizens of North Carolina. I see that despite incredible challenges in our organizations and in the environments in which we serve, this association and our systems are incredibly aligned to face those challenges together. I also see an NCHA staff that's poised to help us to succeed. Thomas Johnson is with me today too. He's the CFO at Southeastern, and he's been there for over 20 years. And he said to me one day, Joann, you know, 10 years ago, it was so much easier. If we needed to improve our bottom line, what do? We raised rates. Done. Bottom line improved. Can we do that today? Absolutely not. Healthcare has changed significantly. You know, through the years, quality has been monitored in all of our organizations, but it's only now that it's being publicly reported. In the past, we as administrators took care of our business in our hospitals, and we made sure that patients who showed up on our doorsteps were well taken care of, and then we sent them back out into the community to be cared for. Physicians took care of their practices, they did their things, but it really wasn't in coordination with hospitals. We really coexisted. There was never terms like alignment and engagement and all of those. We just got the work done that was put in front of us. That is not today's healthcare at all. I want you to know that at the board retreat 2 years ago, we started a very important conversation about NCHA. At that board retreat, we talked about what's the H in NCHA. What does that really mean? And we first started saying, well, it's hospitals, of course. It is the North Carolina Hospital Association. That's what we've been known for a long time. That conversation quickly changed from hospitals to hospitals and health systems. And then the realization was, you know what? There aren't any real just hospitals out there anymore. Every one of us that are running an organization today that is associated with a hospital has a lot of other things associated with it as well. We have clinics, we have fitness centers, we have long-term care facilities. We cover pretty much the entire continuum of care. So we finished that conversation with there aren't any hospitals anymore. So NCHA is not just representing hospitals, but we're representing health systems. It may be a single hospital health system, or it could be a multi-hospital system across North Carolina. But that's who NCHA represents today. Last year, we started the development of a strategic or transformational framework. That conversation was also a very robust conversation. We spent all of our retreat last year saying, what does it look like for NCHA to represent health systems across our state and be on a transformational journey with us? What are the things that NCHA should be focusing on? And we came to the point that there were three things. First and foremost, NCHA must be influential. Second, NCHA must be transformational. And the third is that NCHA must be excellent. I'm going to take just a minute to describe to you what we meant by those three terms. To be influential, NCHA will remain relevant with hospitals across North Carolina. If we're not relevant with you, NCHA cannot be influential. Membership will remain stable. If the members aren't all together, we will not be influential. Members will be active participants in advocacy efforts. We got to do it together. We can't do it individually. Proactive steps will be taken to establish positive relationships with elected officials and other professional and trade organizations. We need partners as well. We can't do it by ourselves. We will know we are influential with elected officials when they can effectively articulate our positions on issues. If they don't know our issues in the position where we stand, we're not going to be influential with them. They may not agree with us, but they need to be able to articulate it so we know they heard what we said. We'll know we're influential when we are contacted prior to decisions that are being made so that the impact on healthcare can be known before that decision is made, not after. Not coming to us and saying, oh, by the way, I've already voted on this and this is what happened. That's too late. We'll know we're influential when we're viewed as a resource and a source of truth for what I consider all things healthcare in North Carolina. We may not be able to articulate the individual position or the impact on an individual organization, but collectively we need to be able to articulate what's happening across the industry. And we have to be believable. We need to be the source of truth for that. For NCHA to be transformational, it must first transform from within. If we're all transforming, NCHA cannot remain as they have in the past. So things are going to have to be different for them as well. Currently, NCHA the staff participates in multiple lean projects within the staff itself. One project that they're working on today is related to proactive communication with the field as it relates to advocacy. Advocacy is an extremely important issue for us and a primary concern for NCHA. They're working to establish a means for collecting data from the field prior to the legislative session. You know, in the past, we've gotten into the session and then said, okay, now what's our position on this and what do we need to do about it? This year, the transformation is we want to know what our position is before the session ever begins. And we want to be prepared for that. We want to be proactive and not reactive. For us, we want to make sure that the staff is identifying a way that your voice is heard from across the field. It's important that we hear from the western side of the state to the eastern side of the state, from the north to the south. It's a little bit different in every location. So for the best decision to be made and the best position to be taken, we need to hear from everybody. Internal transformation will position NCHA to be better prepared to advocate on our behalf while giving us information to advocate at the local level. They're going to be helping us form the statements at our local level so that we can inform our representatives about the issues. It will also provide a basis for assisting each of our organizations on our transformational journey from fee-for-service to value-based system. NCHA should meet each of our organizations where we are, not force any of us to be at the same place at the same time on our journeys. That's transformational within NCHA. One size doesn't fit all when it comes to our organizations. The Excellent Initiative sets the expectation that NCHA will be the most effectively and efficiently run association in the country. I think that's a pretty high bar. But we agreed at our board retreat last year that that's where the bar should be. It will represent the diverse constituent parts that will make up transformed integrated health systems. That's a challenge for any organization when you have that kind of diversity, or the kind of diversity we have in our state. The 2020 goal is that NCHA will have supported its members' transformations and will have transformed its own work to become the association representing those transformed entities. We're in the developmental phase for this. It's not complete, but one of the things that I can assure you that for NCHA to affirm its success, there'll be continuous monitoring of the outcomes using a metric-driven process. We're all doing that, right, in our organizations? NCHA should be held to the same level. We need to measure the important things for us and for our association. For NCHA to be successful, we need members that are actively supporting this agenda. Support doesn't mean that we all have to agree upon everything or that we have to be doing everything exactly the same way. But it does mean things like, if you're called for your opinion, share it. Information is power. It means we actively participate in the services offered by NCHA when appropriate and possible. It means we need to submit data to the Quality Center or to the Center for Affordable Health Care. If NCHA is to be influential, if they're to be the source of truth for us, they need to help us with that data. They need to understand, and it's incumbent on us to share that data with them. It means that we seriously consider the collaborative opportunities presented to each of our organizations. Together, we are better. Collaboration makes it much better than trying to do it by ourselves. I think it means, most importantly, that we inform and educate policymakers, legislators, and the public across our state about our efforts to work with each one of them. We need them to be partners with us as well. We have a proven track record of providing excellent care to the population of North Carolina because we are collaborative. At the board level, everyone has an equal vote and an equal say in the positions taken by NCHA. We value the opinions of all of you across the state. We want our families to benefit from a healthcare system that works for all of us. We know our systems change lives every day. We want all of our systems to be as strong as possible. If we are willing to come together as a field and bring about change, we will make North Carolinians healthier, ensure viability of our healthcare systems, and reaffirm the ideals that led us into this field. I chose healthcare because I wanted to make a difference. Growing up in Eastern Kentucky, healthcare was very limited. Healthcare wasn't always available. So one of the things that I've wanted to do is to make sure that healthcare was accessible to everybody. You know, we didn't take healthcare for granted in that small rural area in Eastern Kentucky. We fully appreciated it. I want our state to fully appreciate what you do for them every day.